Okay, the first slide, this is just these are the topics I want to just touch on quickly today in terms of bull fertility. The first one there is body condition, so BCS that you're all aware of. BSE is breeding soundness evaluation. Now that's more typically what the veterinarian does when it comes to your farm, okay? So that is not mad cow disease. It's got the same acronym. So that's the breeding soundness evaluation. Then the third topic there is weather. So yeah, wet, dry, windy, all these things. Disease and infection, on which we spent quite a bit of time yesterday, and I think the parameters there are clearer. And then we have injury. What effect does injury have on bull fertility? Genetics, genes, I'm not going to elaborate too much on that. That's a stud breeding division. I'll leave that to those experts who are going to elaborate on that. And then, of course, the other one is animal behavior. That's dominancy. And then the last point is bull to cow ratio, which is important. All right, so body condition score. In South Africa, a lot of us use the 0 or the 1 to 5 system in terms of body condition score. In other countries, like in the States and so on, they use the 1 to 9 body condition score. So when you read literature in South African context, often you will see an animal is scored a 3. The equivalent of that is roughly a 6 on the 1 to 9 scale overseas. So just to clarify that, because yesterday someone said, I've got an animal that's at a 6, so I realized, okay, maybe in some breeds you use that methodology of body condition score. So always remember that when you read literature, that you're on the same level, same scoring for body condition score. Otherwise, you're going to be off spot there. All right, so we would like a bull to be a sort of a 3 out of 5 body condition score. Challenge is that if the bull's body condition score goes down, that's 2 out of 5 score, then it affects semen quality directly. All right, and yesterday, just as with the female animal, we said there is a direct correlation, a positive correlation to have more fat than skinniness or a thin animal in the female animal. You can see in the bull, the balance is 3 out of 5. So you don't want a too skinny bull and you don't want a too obese or overweight bull. All right, so overweight body condition score, you then have a lot of fat deposition and you have poor cooling, especially in the testes, scrotum, and that can affect sperm quality quite drastically. All right, and then also not just the semen quality, the sperm evaluation, but the actual animal that's overweight, they generally are much more lazier. They are more lazy. Okay, so that's body condition. So BSE, breeding soundness evaluation, there are 3 parameters that are quite important here. Scrotal circumference, so there are some abbreviations or acronyms there. And scrotal circumference is once again linked to puberty of the animal, and it will also vary from some breeds. You will not expect a little Dexter bull, which is a great dual-purpose animal, but you'll not expect that little bull to have the scrotal size of a Simbra, for example. Okay, so within a breed, there's a sort of a scrotal parameter that the breed society will set up. So that is directly correlated to so-called fertility. Okay, so a good size scrotum, correct scrotal circumference, you have a good testis that's producing good quality, high enough volumes of semen. Okay, physical evaluation, that is when you do that in 2 ways. One, yourself as the owner, you have to do a physical evaluation of the bull. So in other words, you can't just put the bull out to pasture or to paddock with the cows and the heifers and just expect old Charlie out there to do the job. He might not be able to mount the cows or heifers. You have to check. They have potential injuries, which I'll get to just now in a further slide. So you have to do a physical evaluation when you drive around and work with the animals. That's the physical part, okay. Sometimes It depends. Sometimes your veterinarian may or may not do a physical examination. How would they do it? They would get the bull to walk from that area to that area, turn him around. Is he halted tame? Is he a bull that's not tame? You get the animal to move around, have a look at it, see is it mobile? Has it got a problem in the hock or any of the joints, etc. The other way to do soundness evaluation, physical, is you actually have to use a dummy cow, or you use a heifer or a cow, and you use bulls, especially bulls that are semen is collected often. They are used to mounting the heifers and the cows, and they'll jump very quickly. They might even jump onto a bull, but that's not what you're going to do. But that way you can have a quick evaluation of, is this bull physically able to. You can have the best semen quality out there, but if he can't mount the cow, he's zero on a contract. Okay, right. Then the semen examination, that is done by the vet. So they will use the probes. The vet will use that electroejaculator, will work and collect semen. He'll make sure he or she will do their best not to get the arms kicked off, but that's why you use that immobilizer. And it stimulates the bull to ejaculate, and you take that semen, and then basically two kind of tests are done. The one is an immediate test, where you take it and you take a drop of that, put it on a slide, you look at it under a microscope. So generally vets who do bull tests in field will have a mobile microscope that they have set up on the back of their buckies, and they'll power it with an inverter, etc. And then they'll look at motility. Now look at the thickness, look at the color, look at the consistency of that, okay? And the other part is the dead sperm, where from that same drop, they will put on a slide, they'll fix it so it's dry, and prepare it with colors that show it up on the slide so they can see it, and then they'll go and do a proper evaluation at leisure back at the vet lab. That's normally how it's done. Okay, so also yesterday I spoke about the BSE, the breeding soundness evaluation. When the vet comes out for a fertility check or sheath wash, try not to do it less than 30 days before you're going to breed, because it doesn't give you much time or chance to take corrective actions. If he says to you, well, this bull's not really fertile, now what do you have to do? Either have to increase its feed because it's in poor condition, or you have to retest them sometimes, especially at the end of the winter. They've been passive, their functionality is down, so they need to be stimulated a bit, and it increases the fertility percentage. Pardon me. So leave yourself enough time, because you might also want to buy in a bull, and if you're going to buy in a bull, what? All right, so yesterday I hammered on this, so have I got a prize there? Sorry, was it yourself yesterday? I'm sorry about that. I realized afterwards you were the first respondent. I should have given you the biggest one first. So my apologies. All right, so I'm going to start with the little one there. That's injection. It's a tetracycline. So what disease did I say do you need to vaccinate your cows with as a sort of a risk or an insurance policy? Yesterday. It's one of them, but the one that's more important that will affect your calving percentage. Yeah, I just knew it by the way he's looking at me. You know, like that guy, can you fang? Can I be? Whoops, can I throw? That's the question. He can catch, but I can't throw. Mooi gevang. Okay, so it's very important. So yes, you can't, with bulls, obviously you can vaccinate them deliberately or per chance with a trichomonas vibriosis vaccine. It will not have a negative impact on them, but it is not a vaccine that is known to inhibit or minimize trich transfer through the bull. But so why am I saying this? Because pragmatically, pragmatisch gesproken, a lot of times you'll be at the crush, you've got a vaccine, so there's no risk when you put that into the bull, because this can happen. So if you put a trich, vibrio, lepto vaccine into a bull deliberately or by chance, more the trich and the vibrio, which are not bull-orientated vaccines, it will not cause any negative effect. Okay. So jy gaan geen negatiewe effek hê as jy daai bul per ongeluk met 'n trigone vibrio enstof inspuit nie. Okay, so die teikendier daar is die vroulike diere, maar jy kan die bulle ook spuit en dit het geen issue op colors nie. It will not do the calves, bull calves any harm either. However, in bull fertility, that reminds me, make very sure that you do not vaccinate any of the bull calves, young bull calves, adult bulls with any one of the two brucellosis bacterial live vaccines that are intended for heifer use. So you do not inject bull calves or bulls with the bacterial brucellosis vaccines. Okay, neither S19 or RB51. They may, will cause orchitis, swelling of the testes, and epididymitis. That's the Babel, okay, the epididymis, that area where the sperm matures. All right, so you do not inject those two into your bulls, okay? And if you inject the bull with an S19, he most likely will test false positive later. Okay, you will give your bull a death sentence via the laboratory. So stay away from that in those two bulls. Okay, so yeah, and an interesting thing in KSU, Kansas State University. Matt, does that ring a bell? Ching, ching, where are you? Okay, close to home, something like that. All right, so KSU, you know, they say if you want to put some information up there, don't use your own information. You must use the other guy's information because there's more validity in him because he's not biased. You're putting up your own information, you are biased. Okay, so an interesting study that was done, and this, because we always talk of bull fertility to the stud breeders, but commercial communal farmers out there, new farmers, new startup, they did work where they found that if herds that are not tested, where the bulls are not tested, there is a 6% decrease in pregnancy. 6%. Mense, dis baie. That's like off the bottom line. So that's a study, an independent studies that were done. Whereas where bull testing was done, fertility popped up, 6%. So if you go and make a sum on whatever your turnover is of your calf crop, 6%, I think is quite significant nowadays. All right, so bear that in mind. So it's not just for stud breeders. It's also important for commercial farmers. Okay, so if we move on, the weather. So, as dit baie warm is, wat sê effek het dit op jou tande? Enigiemand? Maak jou lomerig en lui en is nie lus vir die lewe nie en so aan, hey. Okay. So, with the bulls, also heat stress makes them lazy and they don't want to work in the heat in the day. So if a cow is like kind of on standing heat earlier in the day and goes through the whole day, here and there you'll have a cow that will skip that cycle and she might have to wait till the next cycle. So you might have the odd cow then that drifts in your breeding season that you're using. But more important is hot weather results in poor sperm quality. All right. Just for interest, in the colder climates, in the northern hemisphere, in the very extreme south, I think in New Zealand probably, but more the Americas, the Europes, Asia, northern Asia, those places where it gets extremely cold, where they also have hot weather, but cold can also cause frostbite, for example, on the scrotum and testes of bulls. So just as a matter of interest. But for us, heat is the more relevant issue that affects sperm motility and sperm quality in them. And then also yesterday, remember I spoke about the bull breathing and panting, or the cow, and that results in the pH of the animal's body becoming a little bit more alkaline. Okay, so it's blowing off acids. And in that way, the blood pH in a minuscule amount goes up, becomes sweeter, more alkaline. But on the sperm level or an ovary egg cell level, that change, that little bit of a change, which is little for us, but at that microscopic cellular level, it's a massive change. that can have a negative effect in fertility, okay? That either testing it or if the bull is working, it can have a negative effect. So if you have in the midsummer and you don't have shade for your bulls out there and you're battling to get your conception rates up in your animals, you should start thinking about shade, all right? They need shade to cool off. Okay, good. Right, then we've worked a lot on this yesterday, disease and infection. I just want to give some overview. So we have internal and external parasites that can cause disease and that can infect animals. Bankrupt worms, for example, in cattle, important liver fluke, lungworm. Lungworm doesn't occur in the warm areas, but often in areas where you have moist and it's cooler. So an animal, a bull with lungworm, going to be battling with his lungs and going to be coughing, or a bull that's got a subclinical or a low level of pneumonia is not going to want to walk after the cows. Right, here is a no-brainer question for that bottle of Dectomax that's up there. Which animal species in the mammalian or in livestock production, which animal has the poorest lung capacity of them all? Who? Who? Did you say cows? Okay, there are no farmers participating, so Didi, you've saved everybody. So please come and fetch your... So when Didi says cows, she actually means cattle, nah? Right. Right. So cattle have the poorest lung capacity of all the livestock species. And so when a bull has got a bit of a pneumonia, he's not going to be inclined to walk after cows. Hy gaan staan en hy gaan aan een kant staan. Hy kan nie 10 tree loop nie en hy swaar, so sy longe moet baie hard werk. All right, so remember that. That's why we also focus a tremendous amount, like I did yesterday, on the respiratory diseases, not just for the cow and the so-called sensitive period, but for the other functions, the other things like mobility in a bull. Okay, so, and obviously in beef production in the backgrounders and in the feedlot. So lungs are very, very important. Okay, then we have other diseases like diarrhea, which in internal parasites can cause diarrhea, lack of appetite, weight loss, weight suppression. Some of these parasites can actually suppress the appetite of the animal, and that is directly related to functionality of the animal. So when we think fertility, we're just thinking, oh, the vets come and take a semen sample and check fertility. Fertility is a much broader word, a much broader meaning. Okay, baie breër doel of a beskrywing. Right, ill thrift. Then other diseases here at the bottom, we can see we need to then also keep in mind what do these other diseases do. So once again, I can't overemphasize this. Don't forget, if a bull's had gall sickness, if he's had red tort, if he's had heart tort, if he's had pneumonia, okay, anything with a fever, 3-day stiff, Rift Valley fever, those kind of things, fever, those diseases. Make sure you have a spare wheel for that one. Make sure you have another bull, because that bull most likely is going to leave you in the lurch. Hy gaan jou in die steek laat, want hy's nie vrugbaar genoeg vir 'n rolweg 60 dae periode nie. Okay, so onthou dit net. All right, then other thing, do not expose cows to foreign bulls. Now, you know, I see in the media, last year somewhere, people are running a cow-bull project, and the idea is very noble. We say, well, here's a cow and a bull, and we'll lend the bull here, and then we'll take the bull back, and Kaya will lend the bull to you, en dan vat ons hom weer en sê, Tokkie, hier kom hy na jou kant toe, and we do that kind of a thing. That's dangerous, foolish practice. Okay. You run a closed herd system. So unfortunately, we have cattle that are in a communal system. A lot of those animals have a fair immunity against many of the diseases, but that is one of the areas where that kind of interaction, unfortunately, does have a negative effect on the reproduction potential of cows. So where you can, if you've got a fence, there you need to think of, do not beg, borrow, lend bulls out. You don't lend your bull to your neighbor with the best intentions, whatever. that bull comes back, he's got trike, vibrio, brucella, or any one of these things, the problem is not his anymore, it is now yours. Okay, so moenie dom wees nie, don't do that. Right, so that also applies to the leasing principles of a bull. Very dangerous practice. Dankie. So, all right, therefore, once again, I cannot overemphasize this trichomonas, vibriosis, leptospirosis, especially that one in your cows. That is like for me, if you're not doing that on your farm, you're walking on a time bomb, okay? You actually have a landmine that you're carrying around. You just need to step on it at the right time. And when you have that loss, don't phone me, because I'm going to laugh at you. Because I warn you that it's really a serious condition. And all it takes is to just use the vaccine, which will minimize the risk of that. Right, so it is my job to put the fear of in you. Kijk, ek moet julle bang praat. Want die punt is, dit gaan oor produktiwiteit. As jy nie kalvers uit daai koeie uitkry daai seisoen nie, dan is jy in groot moeilikheid as dit jou primêre lyn van produksie is of inkomste. Okay, so disease and infection, we've touched on that. So this trike vibrio, it's transmitted predominantly or mainly by bulls. And, often I hear and I see on adverts, I see an animal's being auctioned as a part of a 3-in-1. 3-in-1 pakkie. So our kind of logic says, and you're an auctioneer and there are other auctioneers, it's not your focus, but I do need you to be aware of that. Auctioneers and auction houses need to change their paradigm. They need to do a paradigm shift. You've got to be, they will say to you, it's voetstoot, jy koop hom so. But what you as the buyer, it's your responsibility because you raise your hand, you get the bid on you to buy that 3-in-1. So be careful in 3-in-1s, two important diseases. Brucellosis, there are others as well, but in my opinion, brucellosis is the one, and the other one is trichomonas. You can buy a cow, because nou, wat sê my brein? Well, he's a koei, what do I think logically? I think, okay, she's a cow, she's pregnant, she's got one on foot, so obviously her reproduction status is good. Yeah, she's reproducing, but that's not a guarantee that she's not infected or carrying one or both of those two diseases. So I need to make you aware of that. You buy those animals in, and you are running a clean herd principle, you need to keep them separated and or test them. And it's very difficult to test female animals for trichomonas, and they can carry that, and that can come into your herd. So be very, very careful. If you buy those, you need to know where they come from, and that's where traceability comes in. And what is the manner of management on the other farm? And do you know whether they have a vet going out there? Because you can find out a lot of this stuff for yourself. Okay, so be very careful of that, right? So this disease can be transmitted like that. Then also what happens is that the female, the cow, the heifer become infected in the uterus. The bull is infected. Younger bulls take a little while, and older bulls often are more infected, and they are bigger spreaders of the disease. So if the uterus becomes infected from this bug, this protozoa, it causes like a pussy environment. There's 'n bietjie etterig daar binne, and she will pass out a bit of pus at the back, and you might see it as like a yellow pussy bull string on the cow. Okay, so she's not coming on heat. When you see that on a cow there by the vulva and those hairs there, you need to start thinking, oh, frack, and those individual cows you can test because she's then infected and has a high level. But it's very difficult, it's impractical to go and take a uterus sample of every cow thereafter because the cervix will be closed and you'll not. But that cow, the cervix is open and she's passing out bugs. And you can test those odd cows. But we use the bull, pardon me, we use the bull as the indicators. Okay, they're the ones we can test easier. All right, so that'll take that cow 3, 4, 5 cycles to clean out. But so inevitably what happens on that chart, the cow starts moving off the calendar. I call it, sy skuif van die kalender af en sy gaan daar aan die platkant van die plat aarde afval. So you're going to sell her out because she's not fitting into your production system. All right, that's what happens. All right, and obviously it will increase your length and your intercalving period, and you'll have a decreased pregnancy. bottom line effect is, rand and cent effect hierdie ene. Good. So, other diseases like IBR and BVD and chlamydia, these are also diseases that can occur not just in the cow but in the bull. So a bull that has a current IBR infection, has a viremia, can potentially be infertile, potentially, short period. BVD as well, BS virus diarrhea. So they don't get the diarrhea. That's a northern hemisphere description for one of the two types of the BVD. Here we get pneumonias, we get reproductive problems, and what the BVD does for a short period, it's immune suppressive. It suppresses immunity. And just now I'll talk about infected calves, what happens with them that are infected in the uterus. Right, so BVD, so that's why you do these precautionary preventative vaccinations that you do when on a program, in time, now. You do it. You get into that routine. All right, minimize the risks. Then in IBR, so you can have the resorptions, abortions, and it results in longer gestation, longer period to fall pregnant, and also a reduction in pregnancy and your calf crop. So if you now go, I call them the klein jakkalsies, these are the little jackals. So they say in Afrikaans, die klein jakkalsies steel die wingerd leeg. Meaning that if you have a lot of these little things, one little jackal will take 3 grapes here and another one 10 there and 15. If you add them all up, they've cleaned out that whole bottom string of the orchards in the vineyard, all the grapes. So hy maak, hulle strip al dat. So as jy al hierdie klein goedjies begin by mekaar tel, en jy bestuur hulle nie, dit is wat jou winsgewendheid ook kan beïnvloed. So voeding is baie belangrik, en die bestuur, maar hierdie klein jakkalsies is baie belangrike goeders om tot die minimum te beperk. Right. Goed. BVD, here I just want to focus on the last bit, basically that if you can have any one of those conditions occurring, but the other important one is that if a calf or an embryo fetus becomes infected in the first 120 days, and why am I talking about this in bull fertility? Because you can have a bull that's infected and can transmit it in the breeding action or through nasal contact in the herd. So once again, if the herd is not immunized, there are cows that are susceptible. So if the cow is not susceptible, that uterus becomes infected. The embryo fetus in day 1 to day 120 approximately, that virus starts growing in that little animal. And the animal's body then sees that virus as if it's a liver or a kidney or a lung. So it sees the virus as part of itself because its immune system is not able at that stage yet to defend it, because the uterus is a fairly enclosed environment. Die baarmoeder is basies soos 'n geslote stelsel amper, okay? Right. So daai colors as hulle daar uitkom, those calves when they're born, they are then potentially so-called PI calves, and these PI persistently infected calves, they remain runted, stunted, hulle bly sulke kroeskallertjies en hulle groei nie naaste by die tempo wat die ander kalvers groei nie. Right. So wat genetika en so aan betref, as jy hier in jou kudde, dan uit die aard van die saak hier en daar kalvers hê wat besmet raak daarmee, en dan verloor die genetiese materiaal, se potentiaal. Goed. So the calf cannot heal. They become PIs only in the uterus. Al word hy buite siek, as hy gebore is en hy word besmet, dan word hy nie 'n PI, 'n persistently infected of 'n permanent geïnfesteerde kalf nie. Hy word siek, hy kom oor die siekte en hy bou teenliggame op. As hy binne in die baarmoeder besmet raak as 'n groeiende embryo fetus, dan en hy oorleef, hy word nie geaborteer nie en hy oorleef, dan is hy klein kalfie verraas, hy kroeskalf wat die hele tyd hoes en nies en proes, en hy skei virus by enige gat wat hy het uit. Okay. Voorste gate, agterste gate. Ja, okay. Right. So, hy blaas virus uit. So, hy bly 'n besmette bron. En daai kalvers moet jy van die plaas afkry. Those calves, you have to get rid of them on your farm. And if you're not applying a BVD vaccine, most of the BVD vaccines out there generally will provide an immune response against this and will minimize these PI calf percentages in your herd. Okay, so here's just 4 slides I just took out from Chris Chase, SDSU. Matt, what does that say? Acronym SDSU, South Dakota State University. Okay. All right. So nou weet julle ook. Good. So what just some slides to show you quickly. We'll get back to the bull in a minute. So you can have, most cows become infected when the cow herself is not a PI animal, all right? And she will become infected because she does not have an immunity, because we have not exposed her to the virus disease through a vaccine, either a live vaccine, a modified live virus vaccine, or a inactivated vaccine, virus vaccine, which you have to give a primer and a booster. Normally the MLVs, modified live virus vaccine, normally it's once per year. It's quite efficient to last for most time of the year. So a normal cow will become infected in uterus. But this cow on the right, that she represents a PI heifer. So you can have heifer that's persistently infected, and somehow or another she still falls pregnant, and she will be 100% chance that she will infect a calf. But there are not many in herd. But you have to protect these cows, the negative ones, the ones that, and the way you protect them from it is vaccination. Okay, simple. You end. Right. So to get to a sort of a clean herd, because you've got these shedder calves that can shed all the way around to everything around them. It comes close to them, drinks from the same water, breathes the same air. Hallo Zander, vat 'n bietjie van my BVD, like that. Or urine or feces. Virus is excreted. Okay, any orifice, the virus gaan uit, virus goes out. Right, so there are conditions in there that you have to look at, but it's actually quite simple. You do PI testing, any animal that looks runted, stunted, 1 or 2 animals. You get your vet, they do a little oorknippie dingetjie, send it off to the lab, cost you X couple of bucks, and you know, yes, no, I've got one. Because then you can decide, okay, well, it's positive, so I don't want that animal on my farm. Let it go. Don't sell it to your neighbor. Okay, must be terminal, right? Either slaughter it or send it to the abattoir, whatever. They normally don't grow and pick up a lot of weight anyway. And so testing is important, can be done on individual animals normally. You can test the whole herd, but it's like almost silly to test cows are looking healthy, all right? Because generally you will pick these animals up visually, generally. Then vaccination is like your anchor, your stone. And then biosecurity basically is just your vaccination and making sure you don't buy in these infected animals unnecessarily. Right, and so you need to have those steps in place. Injury, we spoke about injury, so you've got skeletal injury. What I didn't put up here is neurological. You can have an injury of the nerve system. And a bull can have bumped his neck in a fight and injured his nerve, the spinal cord, or a nerve going to one of the legs. Right, so injury of the nerve system is something which can have an effect on fertility. Skeletal injury. Even bulls can have slip discs. Here in the lumbar area, there where you cut the nice T-bones. Big bull, whatever. Then joints, arthritis. Sometimes you'll see an arthritic bull, So what do you think are sort of, when you see a bull or a cow with a joint that's swollen, what kind of diseases do you think do you need to consider, or does your vet start thinking about? You start thinking firstly of brucellosis. Brucella, you can have swollen joints, okay? So be careful to put a needle in there. You don't want to put a needle into any joint anyway. Rather let your vet do that, because if you introduce foreign dirt from the skin and you haven't done a surgical procedure, you potentially are going to cause trouble for that bull's joint, okay? So brucellosis is one. The other one is mycoplasma is also another one, even though it's a respiratory, but you can also have joint ill. Other diseases are like your septicemic joint ills from other bacteria that they get in, naalstring and gewrigsontsteking. In sheep and in cattle, more in sheep, a little bit less in cattle, organisms like chlamydia, chlamydiosa, enzootiese abortus in skape, So even cattle can get enzootic abortion, though enzootic abortion is a little bit more prevalent in small stock. So if you have swollen joints in lambs, you start thinking of enzootic abortion. In cattle, yes, it's not top of the pops, but it is a possibility. All right, so all these things can cause the animal to be infertile, anarchis, infertile, because it's not mounting, covering, doing the job. Right. Then hoof injuries, where they walk on, it depends, are you in a dairy or where are the bulls walking? Are they walking on very stony areas? Do they have long slippered hooves, in sandy soil? Are you checking that the hooves don't have these long slippers? Skier jy daai hoewe af, want hulle kry daai deurtrap, maak die gewrigte, die ligamente seer en daai tipe van bulle. So those kind of bulls might have a problem. Right, hanging sheath prolapse. Last night we had a bit of a discussion about that. And I know as a young vet, I remember seeing many long sheath bulls around. And one of the areas I practiced at some stage was in the bushveld or the thornveld, doringveld. So, you've got these little shrubs in these bushes. Can you see? Tokkie, kan you see daarachter? Can you see? You're going like this? I like, that's better. Okay. Donkey. She's a great sport. So these small shrubs, that bull with that pendulous sheath, and as hare, their hair on the prepuce, that bull hooks. And I've noticed since I was a young vet to now a little bit older, a little bit. It's like Fafa Malan. He's just a little bit older, that guy. He don't get old. He's pretty awesome dude. I have a lot of respect for that colleague of mine. So hanging sheaths have decreased tremendously. There's been a lot of focus through genetics and breeding selection. So the people have done an excellent job in reducing that. We used to have a lot of sheath problems. Today, a vet gets excited when he has to go and do a sheath thing, a sheath operation or a sheath assistance. They're not in the multitude anymore. So, all right. So, and then, of course, there's too much, too little sheaths. We spoke about that as well last night. Right, scrotum injury. Be careful. You can have physical injury where a bull can be kicked or something. You can have an abscess developing in there. Or you may have accidentally, or someone may have accidentally put in an RB51 and an S19 vaccine. So even the bull will not test positive for brucellosis if you use RB51 vaccine in him. He potentially can develop orchitis. Hy kan orchitis ontwikkel, testis swelling en epididymitis. Die epididymis, die bybal, kan ontsteek raak en swel en hard word. Alright, een of al twee kante. Right, that's from the vaccine. Or you can have it also just from the field strain infection, getting infected. So that results in infertility. Right, so watch out for that. And then penis injury. A bull can injure himself when mounting the heifer or the cow. And then you have a penis which is kind of, it's not broken, but it's skewered, it's injured, the ligaments torn in it, tries to mount the cow, therefore he cannot because the penis twists like that and he cannot go into the vagina and to deposit the semen there. So that bull is infertile. Okay, and normally with those ones, it's sore, it's discomfort, and they will not, after a while they learn not to jump the cow anymore. And so if you see a bull that's not active, maybe that's one of the reasons. And that's why we do BSE, breeding soundness examinations. So between yourself and your vet and your caretaker of the animals, the person looking after them, the herdsman looking after them, find out, see, hear what's going on. Right, so those are injuries. And then dominance. This is quite easy to understand. Bunch of bulls, you put in a new bull, whether it's big or small, hulle het 'n rangorde. They have a hierarchical standing in there. The strongest, biggest one or whatever, doesn't have to be the biggest one. It can be the fastest one who can knock the other bulls on the chest or wherever, can win them or hurt them. He will be the dominant one. So it's not necessarily determined by size. So you have to check. Some bulls can be smaller, but they're real little dynamite packets. So if you have that kind of a bull, he's under that one, you've got to pull him out. All right. Or you might have an individual bull which is being bullied by all the other bulls, almost like you have in feedlots. So if you have an individual bull like that, he might not be able to do the job because he's being bullied by all the other bulls. So that's where dominance comes in. Okay. Right, so fighting and obviously injuries. Right, then there is the aspect of bull to cow ratio. So in younger bulls, it is found that you generally cannot give a young bull from 17, 18, 20 months till he's at least 2 years. They will not be able to cover more than 17 or 20 cows. Okay, there's no dom, hulle weet nie hoe wat nie, and they chase after the one cow the whole time, and they lose focus on all the others. So there's, you know, that joke that the two bulls are at the fence, and the young bull says, "Hey, let's jump over the fence and quickly mount that cow." And the old bull looks at the young one and says, "It's pretty obvious you're new on the block. Let's just walk slowly through the gate, and we go slowly through the fence into that camp, and slowly we will mount all the cows one by one." All right, so the old bulls are like that. They can handle 30 to 40 cows. All right, but I wouldn't push it to 40, especially if it's hot. But those are kind of the parameters. All right, so when you're mixing bulls, you also have to keep that in mind, that ratio. You can't just say, okay, ek sit nou 5 bulle in and just assume it's 5 times 30 and it's going to be that amount. All right, so you do have to watch their behavior. You do have to see who they're getting to and who they're not getting to. All right, then bull power. You can keep your bull power up there. If you have a number of bulls in your herd, you can strategically put bulls in. And by putting in bulls, it's always better rather to put in more than one. You put in, say, 2 odd bulls. So you take out like about a third and you leave 2/3. So every couple of weeks through a 3-month period, you can take like 1/3 of the bulls out, replace them with 1/3. So you always have new bull power, fresh ones in there, like a relays. The rugby game where the guys are coming off the bench, né? The impact players, the ouens, né? Ek sien dis 'n paar jong rugby manne, nou verstaan julle waarvan ons praat, né? Right, I see there's agreements here. So you bring in those impact players, you put them in, and you take the other ones that are tired, you take them off. They recover, you feed them up a bit. 3 months is a bit. 82 days or 90 days, let's just round it off at 3 months. So that's part of bull management, so you can keep your bull power up by doing that. Right. Then sensitive periods, we touched on that ad nauseum. I just want to remind you again, ad nauseum. We look at what we do, where and what, temperature, and in those periods, before fertility tests, and or before breeding, and during that 0 to 12 weeks, the 3 months, the time that the bull is in. Okay, good. We've touched on all of those. Nutritional disturbances. Here, not so much. The animals are in good condition, but be careful sometimes if a bull eats too much, and he might develop acidosis. So what's acidosis got to do with temperature? Not much really, but on a cellular level, you have an effect that pH becomes acidic. Né? Hy val, en op 'n mikroskopiese vlak kan dit potensiële effek hê op 'n bul se vrugbaarheid, op die saadkwaliteit. Right. So beware of that kind of a thing. Okay. Infectious diseases, there are numerous ones, bacteria, viruses, chlamydia. So heading off towards the end of our presentation, tick-borne diseases, to remind you, these are the challenges you've got. You have a lot of challenges out there, but you can manage them. Red water, temperature, gall sickness, temperature, lumpy skin disease, temperature, tick toxicosis, not so much a temperature, but the toxins that are caused by either brown ear ticks that are sitting here, because maybe you don't believe in cleaning them and you leave the bull must now survive out there because you don't want to use the dip on them. We had a discussion like that yesterday. Somebody said they know someone who just leaves them. So if you have that kind of a challenge in the ears, I'm telling you that bull's not going to be as fertile as it should be, right? So, and also sweating sickness. So even other diseases, you get winter paralysis ticks, some of the flat ticks that you get here in the Karoo kind of area. Mias was showing the Karoo and so forth. So that winter verlammingsbosluis, can not only just affect sheep and lambs, but can also affect cattle. So they can get many of them onto one bull and then paralyze it through its tick toxicosis. Okay, the animal's then deemed infertile because it can't function. Right, you can die as well, but it's not often then, but it's possible. Then trypanosoma, we don't really get it here, but going towards the Kruger Park and those areas, we don't kind of have it at this stage, but where all those game reserves are, cattle boarding on that, Umfolozi, Suslui, blah, 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 all those ones on the eastern area. Many, many years ago, East Coast fever, and not only about East Coast fever, but diseases like corridor disease, corridor siekte, bees, buffel, brown ear tick interaction, bulls, that can affect them, and those bulls can then, they are sick, so their fertility can be affected. Right. Somebody said that they're from Doer out in the east. That's very close to your base, Tito, I think. Right. So it's not endemic here, but just out of interest. Right. And then we've mentioned 3-day sickness ad nauseum, and then also Rift Valley fever. Rift Valley fever much more prevalent in small stock. Doesn't mean that cattle cannot get it. And remember, this one, Rift Valley fever, is a potential zoonosis. Okay, so when you're working with animals that are aborting and that, you have to wear protection clothing, disinfect properly, don't put hand in mouth, that kind of stuff. Don't take sami and eat it whilst you're working. Okay, right. Hey Kaya, you good? Okay, so to end off, going in that direction, so genes, genetics, scrotal circumference, these things are heritable, so we look for that because it has a direct correlation to live semen, semen quality, semen production generally. There is always the exception to the rule. You can always have a bull whose scrotal size does not comply with breed standards or this or that, and be a fully functional, fertile bull. So don't just assume it is, okay? But in general, those are the rules. Dis die parameters wat ons toepas. Okay, and then of course, semen quality, fertility, and then what your vet will look at is the things under the microscope. How do these little sperm move? Are they moving, is hulle vol energie? If they're not moving in the right direction, or they're swimming in little circles because the tail is kinked, no, it's a stert defect, has a tail defect, or any part of the head or the neck area of that sperm, it can affect the way it moves. And if it cannot move in a good area vigorously, it can't compete with the other couple of million dudes out there to get to that egg cell. All right, so that's very important. Your vet looks at that, does a smear, does a live check, and he does a dead check. Live, he looks quickly, and then dead, he takes it, stains it with stain, looks at it under the microscope, and then he looks for these defects, because you cannot see those defects just like that whilst they're swimming. You can see the odd one that's turning, but generally you want to see where is the tail skew, this side or that side. So you'll see that on the slide. All right. So that's where an evaluation like that's important. And then also not only that, but the vet will also look for other things. Obviously, I've discussed many of those, the color and foreign bodies or things. Are there lots of white blood cells in there? Wit bloedcelle, because we can see that. And there is smear, and that is an indication of a potential infection. So that kan 'n bakteriese infeksie wees, of dit kan 'n Trich en 'n Vibrio wees, whatever. So it can be bacterial or protozoa. And so the vet sees that, he'll start thinking, and if he sees red blood cells, hello, what are red blood cells doing among semen? So maybe up in the whole tract somewhere there's something bleeding. There's maybe a gewas, a neoplasm, a bladder, something which is dumping blood cells or infection into the whole reproductive tract of the bull. Okay. Right, so nowadays you even have very smart computing tools where the guys just take a drop, put it on there, he does the next thing, that thing does a count and gives him the motility score and how many live and how many dead and how many are swimming skew, all that kind of stuff. So there are very smart technologies available out there for veterinarians who do this kind of work, which helps to make the job easier. Can you imagine when you have to do 32 bulls in a day? I don't want to be around. That's quite a story. you're really running around to do 32 bulls testing in a day, even 20, because you have to go through that procedure with every bull. And if you do a lot of bulls and you're chasing, your chances for making errors are bigger. And so that doesn't leave a good taste in your producer's mouth, because los 'n bitter smaakie, né? And dan sê die bulle is onvrugbaar, but it was just because I was in so much of a hurry that I overlooked something. Okay, so it's the human factor. So that helps a bit as well. Technology, we also use that. So there are smart tools out there to do that. All right, then to end off, I think I've got 5 slides left. And so Kobus did ask me, what about first aid? So on a farm, cattle farm, sheep farm, whatever, yeah, you're welcome to take a photo. These are just guidelines, but I think going forward, I will probably be interacting with a lot of you on a willing basis. Those are willing horse concept. No one forces nobody. Willing horse concept, there probably might be some interactions, but a first aid box you should have things in it like a basic antibiotic stock. And yes, your veterinarian may give you, he is entitled, you can, without getting into trouble with the council, can say, okay, Zander, here you are, I'm giving you a bottle of this Schedule 4 antibiotic, but it's for this bull. I'm not going to give you 10 bottles to do all the cattle and or to keep enough stock to last you for 2 years, okay, because you've got expiry dates and all that nonsense. So as a responsible vet, you'll say, okay, here's your 1 bottle, because you're not going to draw it out of a syringe. Yes, we do that from time to time, but once you draw it up in a syringe, it's got to get into the animal, okay? And you can't leave syringes unlabeled lying around, right? That's irresponsible and dangerous and. So I'll give you a bottle, you'll use it, and I know you've got that bottle, because everything's traceable. Most guys have got a point of sale, they've got a system, an invoicing system, etc., etc. So that is also part of traceability. It's being auditable and accountable. Right, so the word traceability has got a very broad ramification. Good. So you need an antibiotic either over the counter or a scheduled. You need anti-inflammatory in the base of cortisone or NSAID, non-steroidal anti-inflammatory drug. So cortisones are good. Cortisones are bad when you're working with pregnant animals. You should use them to the minimum, because cortisol, high levels can induce abortion in pregnant animals. Okay? So we don't want to use it unnecessarily in them, nor do we unnecessarily want to use cortisones in cattle and sheep that we are treating for pneumonia. It's a good drug, but it has some negatives, because it can suppress immunity. All right, if you give it for a high dose a long time. So cortisones we use with care. We would rather use a non-steroidal anti-inflammatory, and there are a couple of them. I've heard some of you talking here, so I'm not going to do a commercial now, but I've heard some of you refer to some of the non-steroidal anti-inflammatories, those things that you java for a lame animal or a sick animal that's had a fever or anything like that. And the respiratory diseases, we prefer to go the non-steroidal. So you don't just grab a cortisone from the box and you just java a pregnant cow just because. You rather use a non-steroidal. You don't just java an animal that's got pneumonia just for the heck of it. You use a non-steroidal, first choice. So it's important to understand which is the correct choice. So if you don't know, you forget, you phone your vet, right? They will know. Good. Then I always say to clients, vitamin B complex. The B complexes are generally created through rumen metabolism. Yeah, even if you're in the green area. But if you have an animal that's sick and it's rumination, say rumenbeweging is onder druk, omdat hy nou koors het of hy het 'n probleem, then he's immediately producing less of those vitamin B complex vitamins. Okay, so that's through rumen fermentation and so forth, where the B1, 2, 6, and 12s are generally produced. Okay, so always a supplement of that to any sick animal is a good idea. Iron injection, normally it's off-label, very often for sheep, but any cow or calf that has just had red water, gall sickness, liver fluke, anything like that where there's a blood loss or a decrease in blood in the body, they do need high levels of iron. Yes, iron is readily available on the pasture, on ground, and in licks, but here you are dealing with an animal. Hier's 'n dier wat deur 'n siekteproses geweldig baie yster verloor het. Né, want lewerslak tap yster, hy tap blood, red blood cells is your highest iron carrying cell in the body. All cells in the body have iron. Okay, don't think that they all have iron. They all have iron in metabolism, cell metabolism. They need iron. But when you have these diseases, your iron depletion is much higher. You're already running into way below. You're now past the reserve tank, or going into red. So you can always supplement. Small quantities. You don't give 20 ml. Unfortunately, cattle and sheep and goats are not that susceptible to iron toxicity if you were to give iron in a supplementary injection. Okay, so a big cow, 5 ml, heifers, weaners, 3 ml, a young calf, 2 ml. All right, we give piglets about 2 ml anyway in the bum, first day that they're born. Right. But that's because they're on concrete, they're not exposed to iron. But here we're treating an animal that's iron deficient because of a disease, be it a parasite or an infection, a protozoa, etc. Right, good. So iron injections. Then you will find in the trade, you will find these multivitamin mineral injections. Use them. You get long-acting, there are 2 of them on the market. And then you get the shorter acting. So when we're finished with the presentation, you're welcome to come and ask me, and I'll explain to you the difference between what I call the short-acting multivitamin mineral supplements, which we generally use for therapy now. You spy dit nou, want dit is siek dier nou, en is laaf vlakke, en het gaan hom nie maklik vergiftig nie. The longer-acting ones are more for production and reproduction, and they've got a depot effect. Hulle het soos 'n depot effect wat hulle het. Jy spuit hom in hou 6 maande. Hy kan nie 'n depot effek hê as hy 6 maande hou nie. Die kortwerkende spuit jy op en 2-3 dae later is daar amper niks meer oor die liggaam nie. Die liggaam het dit opgeneem. So there definitely is what can be called long acting with a depot effect and shorter acting. So there are strategic places that you consider to use them. So in your medicine box, not in your preventative box where you put your vaccines in, but in your medicine box, you use the short-acting ones, which you can inject today, skip a day, jova again, skip a day, jova again. Because they release very quick, absorb very quick. Because that animal's liver and kidneys and cells through the whole body needs that stuff, okay? Because it's in a depleted mode, all right, or going to deplete because of the disease, all right? So those are the multivitamin mineral ones. And then phosphorus. They've got different names out there on the shelves. They need phosphorus. In your body, every cell contains ATP, stands for adenosine triphosphate. And this is basically the driver of the whole Krebs cycle. Every single cell, living cell in your body has a ATP driver in it, because if it doesn't have that, it's dead, it rots. So it has an ATP Krebs cyclus in it, which uses oxygen and energy and food and that to feed the cells and to drive the body. Okay. So phosphorus in an injectable format is a fantastic thing to give in those animals. One that I've not mentioned here is many guys also supplement their 3-day stiff sickness cattle with a subcutaneous calcium phosphate extra booster injector. Okay, because often those animals kind of go into a low calcium and or phosphate in their bodies. And so we need to just help them in 3-day stiff. But that is like a guideline. Then eye preparations. Someone yesterday had a good idea. They recommended that, sometimes you battle to get the animal's head still. You can use they use a disinfectant like a povidone iodine kind of one. It's spray, which is more a skin one, but it might not be the standard or the thing that's normally practiced, but it's quite a pragmatic thing. Like a once-off in the eye sometimes just to get that Moraxella bovis bacteria under control. But generally those bacteria, you can use something like a teeth salve, a spion salve, you can use that. Most of those teeth salves, ointments, you can use an antibiotic. There are different ways of applying that. You can ask me afterwards, but you need to have that in your kit for the eye, all right? And also you might need a tube or two of mastitis remedy if the odd cow does get mastitis, spianus as well, iris as well, just to have something up whilst you're making plans to alleviate that. All right, then to end off the second last part of the second of the 3 slides on the medicine box, you need something on hand for red water, which contains a dimenazine active. There are different trade names out there, right? You need, you need something for gall sickness. So imidocarb does both red water, oops, there's an R missing, does red water and gall sickness. So your imidacarbs do both. But you need to be careful how you use those, because sometimes if you were to use those incorrectly, you can prevent the animals being infected where you have got a natural immunity because you have enough blue ticks in your area. If you use it incorrectly, it can suppress the cattle from being infected and maintaining an immunity. And then those animals can kind of lose their immunity. This doesn't kill the immunity, but it can minimize the effect of maintaining immunity because those actives can work for a long time, and therefore any of the parasites that are transmitted by the ticks are killed. And so the animal's not re-exposed to that parasite. Red water, more, gall sickness a bit as well. But more the red water, that's more red water, okay. So when you use like the imidacarbs or the dimenazines, if you're not sure, just chat to your vet, okay? They can guide you. All right, gall sickness, tetracycline. So gall sickness is also done with the imidacarbs and the oxytetracyclines. Then wound spray is a no-brainer. You need that. Have one with a color in it, which shows you how to spray the animal. It helps to keep the flies and the maggots away. Then just a pragmatic one here. If you have a wound, an abscess, or an infection, it's more in the summer months than in the winter months, and you've got these screw worms or spiker worms, the maggots from flies. You put in an insecticide in there. In the calves, you use a 1%er for safety's sake. For the weaner and older, you can use a long-acting 3.5% long-acting insecticide. You jova that, and that, even though not registered, pragmatically spoken, that will have an effect on minimizing maggots from surviving in that wound for a week or 2 or 3 even, okay? Because it's in the body, it's in the system. When those maggots dig and scrunch in there, they will be exposed to the blood and lymph containing the insecticide, and they will not survive that. So that's a practical thing you can do. When you have abscess, when you have ear problem, you have somewhere there's a wound or an injury, it's not going to heal up very quickly, you jova it, you inject it an insecticide, ivermectin, abamectin, doramectin, whatever, any one of those. 1% is for the babies, and the longer acting you can use in the more adult cattle. Right, so clean needle concept, you should try and use clean needles. Excuse me. I know we don't. Brucellosis you can transfer lumpy skin disease, right? You can transfer gall sickness, galsiekte, anaplasmose. You can transfer that through a needle by using one needle on more and more animals. So needles are cheap by the dozen. I think they cost 2 or 3 rand at the co-op. You should have 300 needles or 600 needles. This vet's crazy. No, okay. It's your choice. You have a clean and a dirty. And also it's very important when you're using needles to inject live modified virus vaccines, the ones that you mix with the water, the powder and the water vaccines. Be careful not to disinfect those needles with a disinfectant, no matter what the trade name is, whether it's a unsaniese ontsmettingsmiddel, soaps, commercial disinfectants. Don't flush them with that if you're reusing those needles. Flush them with clean water in your bucky, just to make sure there's no dirt and skin and gum stuck in the needle hole. You know it's clean. Throw it in a pot, boil it for 10-15 minutes. You take it in your blue Tupperware or your blue bucky there to the crush, and you've got a red one. Who here is colorblind? Wie van julle ken nie die verskil tussen rooi en blou hier nie? Now's your time, or forever keep your silence. Right? We're in agreement. Right, guys? Today we're working the cattle. Vat hierso, moet man vat. Blou is 1 op elke koei of 1 op elke 3. You know, we're pragmatic sometimes. Waar gaan hy vuil na? As nie in die rooi bak, in die blou bak nie, né? Hy gaan rooi bak toe. It's easy. Okay. Right. And you have it there when you finish working. And by this way, you are minimizing the transfer of these potential diseases, especially when you're vaccinating in a lumpy skin disease outbreak. Do not vaccinate ones that are potentially sick. Right. Put them at the back, treat them afterwards, and do quarantine and move them. But when you have an outbreak of lumpy skin disease, as an example, ideally you should try and use a clean needle on every animal. And if you do it, it's quite easy, all right? But that's your choice. I give you best practice. So if you don't do best practice but just practice, well, okay. That's also better than no practice, okay? So as jy een van daai ouens is wat die naald gebruik tot hy so krom staan, jy nie meer kan indruk nie, okay. Nou, jy tender vir moeilikheid. Right, then to finish off, sometimes it helps to have some disinfectant, a scalpel, surgical needles, surgical sutures. They can come loose altogether. Little holding forceps, a rat tooth, curved tissue clamp, scissors, bandage, and dressing material. So why would you want those clamps? Sometimes you get there and you've got an animal and it's got a cut, skin cut, or a other cut, or a teeth cut, or something, and the blood is oozing out there, or it's cut the ear, and it's messy. It may most probably not die from blood loss, but it's messy as heck, and everybody is covered in blood. You just take one of those little clamps, you just clamp it on there. Might not like it, but the minute the blood stops, and you have less shaking of the ear, so you just clamp it with that. You just op die aardkie, okay. So sometimes those clamps are just practical little tools to have in your noodhulpkassie, right? So, and then with permission, I've got 2 slides to finish off. One of my passions is I do Vet2Farm, but I'm involved in GMP, and it's a commercial software for identification, record keeping, calendar actions, disease testing, brucellosis, etc., etc. Last slide, Kobus, thank you very much. So currently I am looking for freelance agents across the country, generally animal health technicians or somebody in that line, because part of this program is also about calf certification. So we also run on the GMP system. Yesterday we spoke about the disease. We call it source verified, right? Livestock preconditioning program, right? So, or certification, LPC, livestock preconditioning certification. It is something which will in the next 10 years systematically will evolve and will become more and more present, and in due course, backgrounders and feedlots will start asking for this kind of thing. But you cannot certify it yourself. And I'm a vet, and we cost a bit more time-wise than an animal health technician. So generally, animal health technicians are much more cost-effective to apply and help in that. And they are third-party people. They can vaccinate rabies. They can sign a certificate. So under a vet's supervision provision, they can do that stuff. Okay. So that is not now, but it's starting. Okay. So just to make you aware. All right. So basically, thank you very much for the opportunity to address everybody. And we have some work to do. Yesterday's presentation, the vaccination part, I've committed I will tidy that up, and I will make that available through Quibus, and you will see that in the next, let's put a deadline, let's say about 2 weeks, we have to have that up and out and available for the people who were here today. And remember, we'll send it out, but always remember, that's just a guideline. If you apply, someone applies that, you forward it to them and they apply it, I will not stand farther. It's only passed on. I'm not going to be accountable if they use it. They use it at their own risk because they've used the vaccine in the wrong place, do the wrong thing, without having a discussion, consultation, guidance, like we have had now since yesterday and today. Then I'm not interested to hear their story, because otherwise their story runs to the Vet Council. We get challenged as vets or by fellow colleagues saying we're just giving this out willy-nilly without indulging or involving the client. So that's why when someone says, oh, can I have that program? And I'm like, then the guy thinks, what's wrong with this vet? You know, he's not supposed to be helping us. Yeah, I can help you, but I must also be careful. I don't help myself. Help my van die wal af en die sloot and concept, okay? So thank you very much for that time, and I hope we've added some value to you, like you said earlier. Thank you.